For depression, we will discuss two case histories, case history 4 and 5. A 51-year-old woman had been suffering from depression for 3 years. This had coincided with the onset of menopause. She felt very low, dissatisfied with life, and sad, and was prone to crying. She also felt vulnerable and burst into tears at the slightest negative comment that a member of her family might make. She also lacked drive and enthusiasm. On interrogation, it transpired that she suffered from lower backache and frequent urination. She always felt cold. Occasionally, she experienced some phlegm in the throat that she needed to expectorate. Pulse was wiry and slippery and weak on both rear positions. Her tongue was pale, swollen with teeth marks, and had a sticky coating. The wiry pulse indicates that there was liver chi stagnation, and this restrains the coming and going of the ethereal soul, leading to depression. The weak pulse on both rear positions, backache, and frequent urination indicate a kidney deficiency, which accounts for the lack of drive and enthusiasm. There is also some phlegm, as evidenced by the slippery quality of the pulse, the swelling of the tongue, and the occasional expectoration of phlegm. The phlegm also restrains the coming and going of the ethereal soul, contributing to the feeling of depression. The next case history is that of a 48-year-old woman who had been suffering from depression for 12 years. Besides feeling depressed, low, and sad, she also felt anxious and slept badly. As she described it, her mind was in constant turmoil. She also experienced a feeling of oppression of the chest and palpitations. Her tongue was slightly red on the sides and swollen, with a stomach heart crack and a sticky coating. Pulse was slippery, weak on both rear positions, and slightly overflowing on both front positions. The tongue and pulse are absolutely crucial to diagnose this case. The redness of the tongue indicates heat, while the swelling and sticky coating indicate phlegm. This was confirmed by the feeling of oppression of the chest. The stomach heart crack is a midline crack that is long and narrow, like a heart crack, but also broader in the center. In the stomach area, the swelling, redness, and the crack all indicate the presence of phlegm heat in the heart and lungs. This is confirmed by the slightly overflowing quality on both front positions, heart and lungs, of the pulse. Such an overflowing quality is often related to emotional stress affecting those two organs. Finally, the weakness of the pulse on both rear positions indicates that there is also a kidney deficiency. Thank you so much for listening.